Hi, so it's Matthew Holt. We are going to have a little bit of fun as we look at healthcare consumerism. I just came back from the AHIP conference in Vegas, where I got to hang out with a lot of fun people, have some fun times in the ice bar, look at some cool new tech and all the rest of it. And I heard a lot from health plans and people selling the health plans about all kinds of different issues, but clearly one of the big ones is the consumer experience. And all people are kind of throwing AI at the stuff and the rest of it. I also heard from Paul Markovich, who these days is no longer the CEO of Blue Shield, but is the CEO of the holding company for Blue Shield, name which I forget. He was interviewed by venture capitalist Julie Yu. A lot of discussion about the different way they're doing pharmacy and the different way they're doing technology and how they're getting data together, interoperability, and how he wants governments to regulate them more. And I have some suggestions as to how government should regulate. And I did see him outside, and I went up to him very briefly, said, "Hi, Paul, good to see you." But I got to tell you, as a member, I'm still getting incredible letters from Blue Shield. I just put a bunch in the trash, where in that case, Blue Shield wrote to me and every member of my family telling us that one of the members of the family had spent a few dollars towards our deductible. And we think we were now on the way to $200 of our family deductible out of 8,000. And we had a letter, each of us, all four of us, including my 10-year-old and 14-year-old, get a letter every time that changes. Why are they doing that? I don't know. So I thought what we do today is look at a couple of things that have happened to me personally and try to figure out how I would navigate through the different systems to get there, including Blue Shields. So here we go. So we are going to start with where I started fairly recently. About a month ago, I went for my annual wellness checkup covered under the ACA. And I'm a 61-year-old man, and there are things that are starting to happen. I'm not in the best of shape, and my doctor suggested a bunch of stuff that I should do. So one of the things we've had a lot of discussion about is the complexity of referrals. In fact, there's a company called Tenor that raised $100 million yesterday to allegedly improve referrals. So let's see what referrals look like. I'm not going to be using Tenor, of course. I'm just using the current state of the art on the Blue Shield website and what happened next. Okay, so here we are. I'm on the One Medical website. This is the this is the summary visit done partly, I think, using ambient AI that my doctor, Andrew Diamond, did to me. Bunch of stuff about this, that, and the other, you know. But let's ignore the fact that I'm overweight. My blood pressure is too high for the moment. Maybe I'll take care of that. Maybe I won't. Let's figure that out. Let's talk about some of the things that I've been sent to. So first off, I was talking about this. I have had a heart murmur for a long time. I don't think it's a big deal. I think Andrew thinks it's a big deal, but nonetheless, in the Amazon One Medical system, they have a care plan, and he said, "I want to send you a referral for an echocardiogram." So here's the echocardiogram referral, and what you should do, how I book a visit. He referred me to this organization, Marin Health Hospital, which is part connected to UCSF, which is got a deal with One Medical. I'm not quite sure how the terms of that deal, but if you like, you can actually see the referral here, the indication, the summary, a bit about me, all the rest of it, blah, 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 what my insurance is. All good. Okay, so what do I do next? Well, what I actually did next was I called Marin Health at the number that was indicated in this number. And I was told they did not have the referral in my chart, and they also did not have the prior authorization, and they had to be sent it again. Well, funnily enough, the reason I actually did this was because I had been sent this. This is a letter sent to me from Blue Shield saying that, yes, I do indeed have treatment prior authorization for this exact service. Okay, fair enough. So it was a bit odd that Marin Health didn't have this, but then I thought of something else. I've heard a lot, as you all have over the years, about the different costs for outpatient referral centers versus hospitals, the rest of it. And this is, I've been referred to a hospital for their imaging center. So I thought, perhaps I should go figure out where I should go for this. And perhaps I shouldn't go to the outpatient hospital, at least try to figure out what the cost is going to be to me. So let me go and take a look at the costs. Okay, so now we're on the Blue Shield of California website, and it's the member web app, and there's a whole bunch of things you can do here. So let's take a look at my coverage and my benefits. So what I'm trying to find out here is what am I going to have to pay under my plan, which is the Exchange HMO on the California Exchange for this. And I come down here into medical benefits. There's something called diagnostic X-ray. Now, this isn't that intuitive because it now says I'm having there's advanced imaging and there's basic imaging, but there is a distinction between an outpatient radiology center and the outpatient department of a hospital. And don't forget, I was being sent to Marin Health, which is the local hospital here in Marin County. So let's look at this. If I go to an outpatient radiology center, and it's an in-network, the copay is $95. Okay. So let's go back and see, well, what happens if I go to, I have to go all the way back to this page. If I go to an outpatient department of a hospital, which I think is what this is, it's also $95. I must have got that wrong. I thought it was going to be a lot more than that. Okay. Now, here's the next question. What are the benefits here? Looks like some quite advanced stuff here, CT, PET, MRI, and all the rest of it. So I assume mine is basic. What would have happened, though, if my medical benefit for this had been, if I required advanced imaging? Let's go take a look again. In that case, if it's advanced imaging, and by the way, this text is almost exactly the same as far as I can tell. Advanced imaging, the cost is $325. So maybe that's different. Let's just check that the other one, let's see what a freestanding center would be for advanced imaging. Let's look at an outpatient radiology center. Cost there is also $325. So you have to figure out, is this advanced, not advanced? I assume it's not advanced, but you can't tell from this, from the way it's written up here, because, these appear to be in both categories. So I was a little surprised, and I thought when I looked at this before that there was a difference between outpatient radiology centers, which are freestanding, and the hospital-based ones, which of course will have site facility fee. You've heard a lot about unequal payments for and site-specific fees, but maybe not. Right. Well, let's for now stop here because I want to go and try and find a center if I want to go to a different place. Okay, so it was a little weird to me as to why they break this up between outpatient radiology center or outpatient department of the hospital when they charge me the same amount, $325 for advanced and $95 for basic, and they don't distinguish on the exactly what the difference is between basic and advanced. I'm just going to assume electrocardiograph. Echocardiograph for me would be basic. But let's say I did want to find a particular outpatient radiology center. So how would I find one? So I'd go to the Find a Doctor tab. And if you look by specialty, this is my location, this is my plan. I'm not sure where I should be looking here. Maybe I'll look in clinic outpatient. It says there are no doctors in my network within 100 miles of this. So let's try facility type and see if we can find one that has radiology in it. Looks like I have radiology domestic X-ray in here twice for some reason. So let's search on those. And there's no facilities in my network. So that's kind of weird. So I'm now looking for a facility. So let's instead try by specialty. Instead of doing clinic outpatient, let's do radiology. And let's select those. They come up again, the radiology X-ray. So let's search those. There's a third specialty selected. I don't know what the third one is. I can't see it in this link. I only see 2 selected. It says 3 selected, but anyway, let's go for that. And now we found 15 doctors, and they're probably all connected to, for instance, if you look, this is where a whole bunch of these doctors are, Brown and Toland West. They're on the same building. I suspect it's a radiology diagnostic X-ray. I expect this one, therefore, is in network, and I don't know if there's a way to find out whether this is freestanding or connected to a hospital. There is a big hospital up in Nevada. There's a Sutter Hospital, but I suspect this is freestanding, and maybe this one is the Sutter Hospital. I think, but well, here's another one just down the street. This is 504 Redwood as opposed to 500 Redwood. So it's a little hard to find out whether they're connected to the hospital. If I look, there was actually one in very close to my hometown. So let's click on this guy. Oh no, that's where I am. Sorry. But that's all there appear to be in this thing, kind of this one. So let's so the Marin Health where I've been sent is actually not, it's not here. So I wonder if I can find that by medical group name instead. If that comes up. And doesn't seem to be coming up. I wonder if I just put Marin Health in, what will come up? Maybe it's facility name. So the South Marin Health and Wellness Center comes up, but not the Marin Health. So this is not, this is well, maybe this is quite close to the hospital. If you look on the map, the hospital is actually, where's the hospital? The hospital is, I believe, it's somewhere in this area. I think it's on this. I think it's in this area right here. But well, if we put the satellite on, we can probably see it. Yeah, I think the hospital's here, so I think that the hospital is actually very close to this center. But I don't know if this is connected to the hospital, and I also don't know if it does radiology. I do know it's in my plan, so I don't know what it is, but there we go. It has something to do with it. All right, so for right now, to me, that's a little confusing. It does tell me that there are the difference between outpatient facilities and radiology connected to the hospital. It doesn't tell me which is which or how I find them or in the doctor search. So if those two prices were different, and I would assume that for some cases, because of the lack of site neutral patient payments, the hospital is more expensive than the outpatient facility. It's not very helpful to explain to me where to go and where to find it. So let's pause this here, and then I'll go back and I'll try and figure out what I need to be doing about my dermatology. Okay, so we know for the first one that there was a referral made to Marin Health, which didn't get there because we see by showing the referral. And we know that somehow Blue Shield was alerted and created a prioritization, and whatever Andrew Diamond, my doctor, wrote on the form was good enough for me to actually, to be worthy of having my heart number checked out. The other thing I have a few dermatology issues, which I won't tell you much about. And I certainly won't show you. They're pretty unpleasant, and they're not on that part of my body. But I have some stuff that I want to get checked out and taken care of, particularly as Andrew thought might have something to do with might have something to do with an autoimmune issue. I don't think it has that case, but who knows? And it says go to referral with Albert Peng. Now here we go. This is a local dermatologist to me, Sweet Drive, San Rafael, and I need to go and pick the referral. Here is the letter about the referral, just some issues about what's going on with me, not particularly great, blah, blah, blah. Again, Blue Shield of California and all the rest of that stuff. So you'd assume now that I need to figure out if Albert Peng, this doctor, is in the Blue Shield network. So let's go back to the find a doctor piece. And I'm looking for dermatology. It comes up. So let's see who's in the list of dermatology. Now it's offering me virtual medical care, which I assume goes to Amwell or to Accolade or to Accolade or now Transcarent or somebody, or in person. So I assume because I have things that need to be touched and possibly biopsied, let's go search for in person. And here we go, a bunch of doctors in 15 miles. Now the location of Albert Peng is very close to me. So here we go. it may be he's not in Brown and Toland, which is perhaps not a good referral. Here are a bunch of people in Brown and Toland in they're all in either Corte Madera or Mill Valley. This is Corte Madera, is Mill Valley. I live up here in San Anselmo, and Albert Pang appears not to be in the network for the HMO. So let me go back and see if we can find Dr. Pang. There's a Leng and a Mei Deng, but there's no Pang. So it's going to come back and say neither of these two are in my network. I'm going to pause it here and try a little experiment. Okay, here's a little experiment. Let's see if I have now logged out of the system so I can log in. So I'm not here. It doesn't right now who I am. It's not connecting it to my HMO. And let's see if we can find a doctor and see what it finds for Blue Shield without this. So let's go back to dermatology. Oh, it's asking for a plan. Okay, let's pick a big employer group plan. Probably has the best coverage. And let's do PPO. That probably mean, and we'll continue with that plan. That probably gets us the widest coverage. And then let's do dermatology. And it's found 42 doctors. Remember, I had 15 before in the other thing. And let's see if I can find one in San Rafael. I still don't see one in this part of San Rafael. There might be one up here. And there he is. There's Albert Pang, a total care dermatology in Las Colinas. And this, by the way, I believe is in the same building that One Medical, which is in network, is in up in this area of, may not be in there. Yes, I'm pretty sure it is in the same building up in this area of San Rafael, but I can't get to them. So in this case, even though my One Medical knows what plan I'm in, the referral they've made is to a doctor who's not covered. So what would happen if I took up that referral? So let's go look at, I have to log back in as me. I'll come back when I've done that. All right, so now I've logged back in as me. It knows I'm in the Silver 73 HMO. And let's try and figure out from the benefits the coverage if I go to a specialist. So I don't know where I would find dermatology on this list. There's a bunch of different stuff. I guess it's just physician, other professional services. There's a bunch of things. So maybe it's office visit consultation. And they tell me that my benefit by cost is $35 per visit, and that covers all kinds of things, I think, including all this stuff. What I don't know is what if I get, and I can go here, if I go to this piece about evidence of coverage, what happens if I go to a provider network? It just says here you'll pay the most to use an out-of-network provider. You might get balance billed. And by the way, your network provider might use some out-of-network providers, so there might be some surprise billing. And it does say you need to replace all the costs to see a specialist for covered services, but only if you have a referral. So I do need a referral because it is an HMO. Fair enough. Doesn't tell me how much I'll pay out of network, because I guess the answer is it won't cover me at all if I go to network. So the answer is I'm going to have to go back to One Medical and say they gave me a referral to a provider who's not in network. So you can obviously see that if One Medical knew properly what my situation was, as opposed to, it's written pretty clearly on the it's written pretty clearly on the referral document here that I have a Blue Shield of California HMO, and he has my ID and my group number, but that doesn't integrate with the referral network of Blue Shield to figure out who actually is in network that I should go and see. And so this is just a doctor that Dr. Pang is the doctor that clearly lives close to me, and Dr. Diamond has referred me to. So I guess the overall answer here is that when you look at companies who are both selling to medical groups and selling at hospitals and selling to health plans, there's a huge opportunity here, right, to sort of basically do this data integration. Most of this data about who I should go and see and where I should go, who the least costly is, and who's going to cost more, and which situations will cost more, which are going to cost less, is all available. It's just not made very obvious in any one place. And I suspect that because I'm a bit of a nerd and I care about this stuff and I'm doing this because I write a blog about healthcare, I'm probably going to look for this. But I suspect that many people would make that appointment with Dr. Peng and be kind of surprised to find that they're out of network and not covered and have to go back and ask for a different referral to a different place. So there's a huge opportunity here, even though we've got now a lot of the data that's available, to integrate it and make it useful for patients. And my hope is that of all the people we're seeing getting funded, whether it's for referral management, utilization management, customer experience, all the rest of it, and all this AI stuff we're talking about, let's hope somebody can fix some of these more basic problems and make the experience a little bit better than the one I've been having.